Hi, my name is Lauren Stevens, and I am a nursing student at the University of Michigan. Today I will be presenting a patient. Patient is a 19-year-old single Caucasian female. She does not currently have an occupation besides being a nursing student at the University of Michigan. Her usual source of medical care is Lori Booms, a local nurse practitioner in her hometown, Lake City, Michigan. Vital signs. Pulse is 72 beats per minute. Blood pressure 100/54. Respiration rate 14 breaths per minute. Pain. Patient reports pain in her shoulder. Pain level is at a 5 out of 10. Her oral temperature is 98.2 degrees Fahrenheit. Patient's chief complaint, pain in her shoulder. The history of present illness. Location of pain is in the left shoulder. The onset of pain is September 2016. When describing the severity, the patient reports numbness in September, sharpness from September through November, followed by severe achiness from November 2016 to present. The patient describes current pain as achy, sharp, but mostly dull. The patient rates her pain as a 5 out of 10. The patient says that this pain interferes with her daily activities such as lying down and picking objects up that are above her head. Aggravating factors include lying down on her left side or picking up objects with her left arm. Efforts that the client has used to treat the pain include taking Tylenol at appropriate times. The patient does not notice any other symptoms that associate with her shoulder besides pain. Patient perceives the problem as previous dislocation and possible inflammation. Past medical history. The patient had tracheoesophageal fistula present at birth. The patient had a case of pneumonia when she was 2 years old and was hospitalized for it. The patient was diagnosed with epilepsy in March of 2013. There was no reason of cause. She has had 5 seizures. Her seizures are all classified as tonic-clonic. Her first was while taking driver's training in March 2013. Her second was at prom in May of 2013, followed by one at another school dance in February 2016. One during her track season in March of 2016, and her latest occurred while at college in September of 2016. The patient reports that looking back at her seizures, stress could have been a possible trigger. The patient reports having dislocated her left shoulder in September of 2016. The cause was that she fell while having a seizure. The dislocation went in a forward direction. Patient had to use a sling for 2 months. However, reports still feeling pain when she lays on it. Immunizations. The patient is up to date on immunizations. Allergies or drug use. The patient has an allergy to kiwi. When she has a reaction, her tongue and throat itch, but there is no swelling present. Hospitalizations and surgeries. The patient was in surgery the day of her birth, 1/3/1998, because of her TEF and was hospitalized for 9 days. In 2010, the patient had surgery because her esophagus was dilated. The patient was hospitalized in 2000 for pneumonia. The patient was hospitalized in both 2013 and 2016 for her seizures. She was also hospitalized in July of 2016 for an EEG for her seizures, where she was kept at the hospital so that they could monitor sleeping and brain testing. In this EEG, there were abnormal findings. Current medication. The patient currently takes 12 milliliters of Keppra twice a day for her seizures, which she started taking in 2013. Try Sprintec once a day, and appropriate use of Tylenol when needed for shoulder pain, and 1 multivitamin supplement per day. Functional assessment. Patient denies drinking, smoking, illicit drug use, or regular caffeine consumption. Patient exercises daily and gets about roughly 8 hours of sleep per night. The patient reports a healthy nutrition and balanced diet. Patient reports wearing a seatbelt each time she is in the car. Patient's psychosocial data. The patient is currently attending school as a freshman in nursing school and is living in the dorms. Her permanent residence is in her home with her mother, father, and brother. Patient reports a solid support system from her family, her friends, and her boyfriend. She reports that her and her boyfriend have a healthy relationship and that she has a multitude of friends that she also spends time with. The patient reports constant stress when at college. The patient reports practicing Christianity. Patient reports having a good, healthy, routine care. Family history. Patient's mother has high blood pressure and high cholesterol. Patient's father has a history of prostate cancer and anxiety. Maternal grandfather suffers from depression, alcoholism, and esophageal cancer. Maternal grandmother suffers from depression, alcoholism, and cirrhosis of the liver. Paternal grandfather has high blood pressure, high cholesterol, adult onset diabetes, and atrial fibrillation, which he takes medication for. Review of systems. Due to patient shoulder pain, review of System 1 musculoskeletal system was assessed. Subjective data. The patient notes having pain and swelling in her left ball and socket joint. Other than that, she did not notice any signs of joint pain, swelling, redness, warmth, or deformities. The patient has limited range of motion in her shoulder. She cannot raise her left hand up completely straight. There is no limitation in her daily activities besides when she wears a sling. She notes having weakness in her shoulder and the ball and socket joint. The patient does not have a history of arthritis. Pertinent System 1. According to the U.S. National Library of Medicine, National Institutes of Health, pressure ulcers are a type of injury that breaks down the skin and underlying tissue when an area of skin is placed under constant pressure for a certain period. When a patient comes in because of an injury where they will need to or are currently wearing a cast, sling, or brace, it is important to also assess the integumentary system. When assessing the integumentary system, the nurse will be able to notice and document pressure ulcers or skin deterioration that may have occurred from the constant pressure of the sling. It is also important that the nurse notifies the patient of these possibilities and how to prevent them. Review of System 2. Due to patient's history of seizures, review of System 2 is assessment of the neurological system. The patient reported no feelings of burning, tingling, or numbness. The patient reports a history of seizures. She reports having 5 seizures since 2013. The patient reports sometimes having concerns about memory or ability to concentrate. She says that when she is at school, she finds it much harder. The patient has no history of insomnia. The patient has no unsteadiness, loss of balance, or coordination. Anxiety interferes with the patient's daily life. When in school, it becomes harder for her because she feels stressed out and has anxiety often. The patient has no difficulties with speech. The patient has no past history of a head injury. Pertinent System 2. Head, eyes, ears, nose, and throat. According to the U.S. National Library of Medicine, National Institutes of Health, vertigo or dizziness are common symptoms often reported by patients known to have epileptic seizures. These vestibular symptoms may be related to the seizure itself, to the side effects of the antiepileptic drug therapy, or may be linked to a second comorbid non-epileptic disorder. It is important to assess HEENT when the patient reports seizures because it can also oftentimes be related to dizziness, vertigo, or fainting. This is important for the nurse to document and make the patient aware of the possible effect of dizziness related to epilepsy. That is all. Thank you.